No, I mean, I don't believe in unnecessary care. I believe in wellness and prevention and maintenance care. When a patient comes in, we start care. Usually the presenting factor why they're coming in is because of pain. That's the majority of the time.
Okay.
My first goal is to get them out of pain as fast as possible. Number 2, sleeping through the night. That's when the body heals. And number 3, just to get it stabilized. And I'm not talking about corrective care for years of care. I'm not talking about that. Stabilization, I'm just talking about the adjustments are holding. Once they hold, they could go out, back out, and do their normal daily activities without it irritating or aggravating or causing restrictions, whatever the complaint was. When they come in, we'll start with a plan, a treatment schedule. We'll work through that. Usually I do re-exams every 4 to 6 weeks depending on the treatment schedule. Mm-hmm. Usually they fall in between 10 and 12 visits depending on what it is. If it's something less or more minor, it might be 6 to 8 visits. It all depends what it is. We'll do an evaluation. If everything's good, I do discharge them from active care. We are done.
Okay.
They know that. We've resolved their issue why they came in. I do give them 2 choices when we're done. Call me, give us a call when it hurts again, or I have kind of like a once a month tune-up maintenance plan. Okay. Some of them choose, hey, I'll come back when it hurts. We'll see you when it hurts. That's about it.
Okay.
Some of them are, yeah, I like this. I like how this feels. I want to stay this way. What do I need to do? Okay. And then we'll talk about that, and we might have like a once a month maintenance plan. It's a prevention. Same thing like eating right, getting rest, exercising, brushing your teeth. All of it is a healthy lifestyle. We'll talk about a healthy lifestyle and what they could do.
And if a physician refers someone to you, how do you keep them in the loop?
If we get a referral directly from a physician, what we'll typically do, on the most part, what we'll do, sometimes we've had little lapses in care because I've had staff transitions over the years, but typically we'll do a little introductory letter to them. Hey, so-and-so appeared in our office. Thank you very much for the referral. This is what we did. This is we're going to start care, and we're going to do an evaluation this time, and we'll let you know the findings at that time. And then let's just say it's 30 days for simplicity purposes. We set them up on the treatment schedule. We do an evaluation in 30 days. I'll do a progress report. I mean, it automatically with computers now, you put the information in, we could just print off a report. And then depending on the report, I'll either send that or maybe a brief letter to the referring doctor just to let you know what the patient's status is. When we are done, they're discharged from care. We'll send a letter to the provider to let them know we're done with care.
Okay, so great documentation. And
everything's documented. Every visit, every complaint, everything's down there.
Okay, great. And if there's something that you feel like that is out of your scope of practice, are you most likely to refer them back to the physician to,
Yes.
Investigate it more?
Yes, if they were referred into me from a physician and it's out of my scope of practice or this is nothing I do, yes, I'll refer them back to that physician, and I might recommend somebody else they might refer to.
Okay.
Another provider or something like that. If we're starting care, but I find that, okay, the patients are responding but not as they anticipate because of something more is going on, maybe I'll get with the provider and say, hey, we need some updated x-rays, or maybe we think we need an MRI, something like that, or maybe I might, refer out to physical therapy, massage therapy, something like that. Or maybe it's another evaluation.
Okay.